Understanding the mechanism of action of Wakix. Let's begin with the role of histamine in promoting and stabilizing wakefulness. In the brain, histamine is a neurotransmitter that is important for wakefulness. The activity of histamine neurons in the brain is regulated by histamine 1, or H1 receptors, and histamine 3, or H3 receptors. Histamine is synthesized in the presynaptic neuron. When released into the synapse, histamine binds to postsynaptic H1 receptors, which increases the activity of histamine neurons. This action allows histamine neurons to communicate with other brain regions that are important for sleep and wakefulness. H3 receptors help to regulate the synthesis and release of histamine in the brain. Unlike other histamine receptors, H3 receptors are located primarily in the brain. Normally, when histamine levels in the brain are high, histamine binds to H3 autoreceptors to inhibit further synthesis and release of histamine in the brain. The levels of histamine in the brain typically correlate with levels of wakefulness. Reducing histamine levels in the brain results in decreased wakefulness, while increasing histamine in the brain plays an important role in promoting and stabilizing wakefulness. Wakix is a first-in-class molecule with a novel mechanism of action and is the first and only histaminergic treatment for excessive daytime sleepiness or cataplexy in narcolepsy. Wakix is indicated for the treatment of excessive daytime sleepiness or cataplexy in adult patients with narcolepsy. Wakix is contraindicated in patients with known hypersensitivity to pitolisant or any component of the formulation, and in patients with severe hepatic impairment. The mechanism of action of Wakix in excessive daytime sleepiness or cataplexy in adult patients with narcolepsy is unclear. However, its efficacy could be mediated through its activity as an antagonist and inverse agonist at H3 receptors, which results in increased histamine levels in the brain. Let's learn more about how Wakix is thought to increase histamine levels in the brain. Wakix selectively binds to presynaptic H3 autoreceptors with a high affinity, with no appreciable binding at other histamine receptors. Wakix binding to H3 autoreceptors prevents histamine from binding to these same receptors, which keeps histamine from inhibiting its own synthesis and release. This action is known as an antagonist effect. Wakix binding to H3 receptors also increases histamine synthesis and its release into the synapse. This action is known as an inverse agonist effect. Together, these actions of Wakix increase histamine levels in the synapse. Histamine then binds to postsynaptic H1 receptors, which increases communication to neurons in other brain regions. As we have seen, through the combination of its actions at the H3 receptor, Wakix increases histamine levels in the brain. Important safety information. Wakix is contraindicated in patients with known hypersensitivity to pitolisant or any component of the formulation. Anaphylaxis has been reported. Wakix is also contraindicated in patients with severe hepatic impairment. Wakix prolongs the QT interval. Avoid use of Wakix in patients with known QT prolongation, in combination with drugs known to prolong the QT interval, in patients with a history of cardiac arrhythmias or other risk factors for QT interval prolongation, and in patients with congenital prolongation of the QT interval. The risk of QT prolongation may be greater in patients with hepatic or renal impairment due to higher concentrations of pitolisant. Monitor patients with hepatic or renal impairment for increased QTc. Wakix is not recommended in patients with end-stage renal disease. Dosage modification of Wakix due to increase in pitolisant exposure is recommended in patients with moderate hepatic impairment, patients with moderate or severe renal impairment, patients known to be poor CYP2D6 metabolizers, or patients taking strong CYP2D6 inhibitors. Concomitant use of Wakix with strong CYP3A4 inducers decreases pitolisant exposure and may require dosage adjustments. Centrally acting H1 receptor antagonists may reduce the effectiveness of Wakix. Concomitant use should be avoided. Wakix may reduce the effectiveness of sensitive CYP3A4 substrates, including hormonal contraceptives. Advise patients to use an alternative non-hormonal contraceptive during treatment and for at least 21 days after discontinuation of Wakix. In placebo-controlled narcolepsy clinical studies, the most common adverse reactions, greater than or equal to 5% and at least twice placebo for Wakix, were insomnia, nausea, and anxiety. Other adverse reactions that occurred at a rate of greater than or equal to 5% and greater than placebo were headache, upper respiratory tract infection, and musculoskeletal pain. Please see accompanying full prescribing information. To learn more about Wakix, visit wakixhcp.com.